The holidays are supposed to be a time of joy and celebration. Yet for healthcare workers, especially nurses, it is often a time of overwhelming stress and burnout. And while families are enjoying a festive meal and time off, we are pulling double shifts, facing overflowing hospitals, and dealing with our own unacknowledged fatigue. It's not uncommon for some of us to feel like we are drowning emotionally and physically. But what if I told you that this stress, this exhaustion, doesn't have to be inevitable? What if the holiday burnout we have accepted as just another part of the job is actually something we can take control over? Let's start by being honest about why the holidays are unequally stressful for healthcare workers. It's not just the increased patient load or the back-to-back shifts. There's an unspoken pressure for nurses to perform not just as professionals, but as emotional caretakers, cheerleaders for patients who may be spending their holidays away from loved ones. Add to this the fact that many of us are also juggling our own families, and it becomes almost impossible to keep our heads above water. The irony, while everyone around us celebrates, we are struggling to stay afloat. We talk about self-care all the time. We encourage our patients to rest, to relax, to breathe. But how many of us take that advice for ourselves? How many times have you skipped lunch because you were too busy? Or found yourself staying late because no one else will do it?
I have done it before.
And here is where the problem lies. The culture of nursing has been built around self-sacrifice. It's in our DNA to give.
I'm sure it is.
But that constant giving comes at a cost. We are caregivers to everyone except ourselves. And during the holidays, this problem is amplified so much. So how can we cope? Step number one, and this is the most important part, is to recognize that we have a choice in how we manage our stress. No, we can't change the fact that the ER will be full, or that we might miss a family gathering or two. But we can change our response to it. Think about this. We spend so much time planning the perfect care for our patients. We create care plans, assess needs, and provide interventions, yet we rarely do this for ourselves. The first thing we need to do is to create a holiday care plan. A structured approach to how we are going to take care of ourselves during this busy time. This plan should have three components: boundaries, time management, and emotional awareness. One of the biggest reasons we get so burned out is because we don't set boundaries. How often have you taken an extra shift because you feel guilty? Or stayed late because you didn't want to leave your coworkers hanging?
I have done it many, many times.
It's time to recognize that saying no is not selfish, it's essential. If you are constantly saying yes to everyone else, you are saying no to yourself. And during the holidays, when stress is at its peak, setting those boundaries become even more critical. It's not just about declining shifts though. It's also about setting emotional boundaries. We often take on the emotional burden of our patients and their families. And while empathy is key to being a good nurse, over-empathizing can drain you. Establishing emotional boundaries means acknowledging that it's okay to care deeply, but it's also okay to let go once you've done your best. The second key to coping is managing your time efficiently. We know our schedules are going to be packed, so why not plan ahead? Creating a routine that prioritizes breaks, even if it's just 5 minutes, to step outside for fresh air. We are great at multitasking for our patients, so let's use that skills for ourselves. Here's a small example. During my shift, I've found that taking just a moment to close my eyes, breathe deeply, can help rest my mind, even when things are truly chaotic. And they truly are sometimes. It's a micro moment of mindfulness. If you can make time for a quick coffee break, you can certainly make time for a quick mental break. And when you are off the clock, make sure you are really off. How many times have you left work only to replay the day's event in your mind? That constant mental rehashing can prevent you from fully recharging. Disconnect from your work, even if it's just a few hours, can make a huge difference in your mental health. And then we have the third key to this puzzle. It's the emotional awareness. We are taught to recognize the signs of distress in others. But do we apply the same level of care to ourselves? Recognizing when you're reaching your breaking point is crucial. And here's the thing. It is okay to admit that you are struggling. During the holidays, there is often this pressure to stay strong for everyone else, but vulnerability is not weakness. Admitting that you are tired, that you are emotionally spent, allows you to take the steps you need to recharge. This might mean leaning on your coworkers for support, reaching out to a counselor, or even just talking to a friend or family member.
Okay, I can do that.
And this brings me to another essential component of coping. As nurses, we are a team. The holidays are hard for all of us. But that also means we can lean on each other. Share your experiences, check in with your coworkers, and remind each other that it's okay to feel overwhelmed. And here's a personal tip that really helps me. Find small moments of joy amidst the chaos, whether it's a quick laugh with a colleague or taking a moment to appreciate the festive lights in the hospital. Those little moments can act as a reminder that there is still beauty in the world, even when it feels like everything is just falling apart. And as we navigate through these holiday shifts, remember this: your well-being matters. Not just because it makes you a better nurse, but because you deserve it. You are more than just your role in healthcare. You are a person with limits, needs, and emotions. If you ever caught yourself thinking, I'll rest after the holidays, I'll take care of myself once things calm down, stop and reconsider. The time to care for yourself is now, not later. Because if you don't, the burnout that follows may last far beyond the holiday season. So as we head into this holiday rush, let's challenge the narrative that stress and burnout are just part of the job. Let's recognize that we have the power to set boundaries, to manage our own time, and to be emotional aware. Yes, it is tough. But we are tougher when we care for ourselves just as much as we care for our patients. The holidays will always be a challenging time in healthcare, but that doesn't mean we have to sacrifice our own well-being. We have the tools, we have the knowledge, and now it is time to use them. After all, what good is a nurse who's burned out? What good are we to our patients, our families, ourselves, if we are running on empty? You and I can cope, we can thrive, and it all starts with acknowledging that we matter too, especially during the holidays. And if you want more holiday advice, check out this playlist right here on the holidays, where I take you through how to cope with these trying times. And I'll look forward to seeing you over on that playlist.